Hello listeners, welcome to Views on Health. A great pleasure as always to have with me on the program Dr. Isurujith Liyanage, Consultant Gastroenterologist, University of Sri Jayewardenepura. I'm sure listeners will recall Dr. Liyanage speak on diabetes-related gastrointestinal problems last time around. Tonight, the program focuses on alcohol-related liver disease. Well, we do see people drinking far in excess of what they should, while not being judgmental. While I'm doing this program, we know for a fact that a lot of alcohol is consumed in our country, in Sri Lanka, and it has led to many an ailment for many people. So having said that by way of an introduction, may I hand the microphone over to Dr. Liyanage to enlighten us on alcohol-related liver disease.
Good evening. It's always a pleasure to be here. I thought of discussing this because we again come across a lot of people with alcohol-related liver problems. Now, we all know that alcohol is a funny substance, so it kind of sometime back there was a belief that there is a safe cutoff or a safe limit to the amount that we can drink, but the current consensus amongst the experts is that now we cannot say that there is a safe drinking limit. So any amount of drinking is harmful in some way to the body. But being a liver doctor, I would look at the quantity, not in that aspect, but there is from our point of view that we have defined what is a safe limit. We check if the patient had been taking in excess to that limit. It may not need be an exact cutoff. So it's kind of it again, we have to look at it with an open mind, judge it if that is excessive or not. But nevertheless, we see if they have been drinking excessively over a certain period of time. We're looking at about 5 years or more. That is when alcohol can impact on the liver in a long-term basis. So that is going towards what we call chronic liver cell disease. So in other words, it's called cirrhosis. But there is another element of alcohol-induced liver injury that we often neglect. That is called alcoholic hepatitis. That is when we either consume alcohol at a very high quantity over a period of time, or if we take a large, massive binge. So in that context, the liver can be acutely damaged. It can cause some acute kind of damage to the liver, and that is called alcoholic hepatitis. And sometimes that can be a killer if that is very severe. So those are the two main places where alcohol can affect the liver. But there's one more thing that I need to mention at the beginning. That is a condition called dual etiology fatty liver disease. That is called DAFLD. That is when you have a background condition that affects the liver, and the most common one is fatty liver that we have discussed on a previous day. But that is, as we discussed, it's very common. And on top of that, if alcohol causes a liver damage, then you don't need to go to that cutoff value. You don't need to go to that toxic value or not so recommended value. You can get significant liver damage even at a lower quantities. That is called dual etiology liver disease, fatty liver disease, and we believe that it is one of the commonest reasons why we see a lot of patients with chronic liver cell disease in Sri Lanka. So we talked about 3 possible ways alcohol can affect the liver.
Dr. Strangely, when you say that like drinking from 5 years and up, regularly for about 5 years, and yet the damage has begun to set in. Now, there are people who justify because nothing has happened to them. Not that I want anything happening to them, but as you know, we have come across a lot of people in Sri Lanka who continue to enjoy their drinks, and they are quite okay. I mean, life is going on for them. So they are very smug about it. I've been drinking for so long. Look at me, I'm good. Why should I stop drinking?
Right. Okay. So I think that's a fantastic question. That comes to a point that I've been trying to kind of bring up for a long time, and I've recurrently been telling. Now, as Western doctors, when we tell that something is harmful, it's like the police telling you not to drive fast or not to overtake when there's a bend. So there are people who overtake in that bend and are not meet with an accident, but it's dangerous. So the likelihood of you meeting with an accident is more if you do that, which is why we ask them not to do it. We don't ask people. We ask people to drive below a certain limit when they go in cities. It's not that everyone who exceeded that limit meets with an accident or kills someone. It's just because that the likelihood is high. So medicine is just like that. So when we tell someone that cigarette smoking can cause cancer, it's not that all people who smoke cancer, but then there's a higher likelihood of you getting cancer if you smoke. If a doctor tells you that you need a bypass surgery, that doesn't mean that everyone in that context who does not get a surgery will die. But the likelihood or the chance is higher than someone who does not get it. Now, strangely, people who die, people who get into trouble and in that population are not there to talk. They're not here to tell us that I've been drinking and I'm all good, or I died. So we only hear from the people who have survived. So that is the reason why sometimes we see people who have been advised to get a surgery, and then they would tell everyone, doctor told me that I need a surgery, and if not, this would happen to me, but I'm fine. See, so that means probably, let's say, eight people who did not have that procedure would have a complication. 2 people would not. So those 2 people are the ones who are left to talk. So it's the same thing. When there are people who take alcohol, they're absolutely fine. There are people who have taken alcohol, they've got into a lot of problems. And before we give these remarks, before something is called harmful. Now, for example, tobacco smoking, there are a lot of controversies behind that, but it took about 50 years for scientists to properly prove that cigarette smoking causes cancer. So that when it's proven beyond doubt, and that is by looking at hundreds and thousands of patients' data and properly analyzing them and undergoing a lot of criticism and facing challenges and then experiments. That's how these numbers and figures and risk factors are called risk factors. So we're not even allowed to call a risk factor some lifestyle related behavior or a figure a risk factor unless we have that much solid evidence. So that is a very important thing, I think, for our listeners, because we should not go by what individual opinions. We should look at the complete picture.
Thank you for that very lucid explanation to my question, because this is something that we in Sri Lanka come across all the time. And this, sort of very confident kind of statements that are made, more so after some drinks, when they are on quite a high. Yes. And they are pretty very good about, in feeling good within themselves. And a lot of bonhomie and all of that. And then nothing health-related comes into the picture.
Yes.
It's just, totally out of the picture. So thank you for that, Doctor.
Yes.
So having listened to you, so we come back to the situation that it is bad. And though it cannot be declared taboo, unfortunately, but life goes on with all of this. I don't know if this is a fair question. How would one be able to resist temptation or resist when somebody urges a person, come on, just have a drink. There's nothing wrong with it. And then especially men, they would feel that, it's not right for me to say no to that. I should go along and accept that drink. So one leads to a second and a third and so on and so forth. And may not go beyond the point that time. The next time, same thing. It's a repeat,
Yes. So alcohol, like all the other psychoactive substances, they affect the brain. And when you get into the habit of drinking, there is a center that causes or that leads to craving, and that center is stimulated and you get a craving for alcohol and you want alcohol. And there's a lot of social pressure in a lot of environments, in a lot of circles with friends, that alcohol is one reason why you need to, or rather a way that you can socialize. It makes you feel good. So there are a lot of positive ideology that goes around the consumption of alcohol, and there's also some negativism on people who don't drink, especially in these kind of environments. That I think is very unhealthy, and it actually is a part of a person's personality and the inner strength to decide whether you're going to succumb to that pressure or whether you're going to stay out of that. And again, I think it's beyond my specialty to talk in detail about alcohol, how it affects the brain and the mind, because I'm a liver doctor. But from the little I know, it's and from what I've been taught by my very great teachers, that alcohol at a very small quantity at the beginning makes someone feel good, and that it is that drives the whole drinking pattern. And then what happens is we get our body becomes adjusted. In very simple terms, our body gets adjusted to the effect of alcohol, so that to get the same effect you need more alcohol. And that is a common occurrence when you drink frequently. So from a liver doctor's point of view, sometimes my psychiatric colleagues will disagree with me, but what I want is to try to cut down as much as possible and try not to take alcohol on a regular basis. So that is one way we can at least. So again, I'm emphasizing the fact that any quantity of alcohol is not good, but as a start, it's always good to cut down and then to have gaps, or rather make sure that you don't drink on a regular basis. And by doing that, you're also allowing your body to heal, not just the liver but your brain as well, so that so next time the same drink gives you a better kick, if you're looking at it in a very bold way. Again, I think some people would disagree with me and would think this is a controversial approach to this, but if someone cannot give up at all, it's better than not trying anything. So it's always what I tell my patients is to have gaps, to cut down the amount and give it some time, so that the lower amount would also give the same, whatever the beneficial thing that person perceived it to give. You'd get the same thing with a lower quantity if you keep gaps in between.
Thank you, Doctor. Now, taking what you said into consideration, when they stop taking, do they have that no feeling good kind of factor? Because they take it and they feel good. And now medically it's advisable to stop, or not advisable to continue drinking. So there's a gap. That gap, about how long is that gap approximately, or is it dependent on each person's condition?
So Fatima, again, it's kind of slightly beyond my speciality. Mm-hmm. It's something our psychiatric colleagues should tackle. But generally, when someone stops alcohol, two things happen. One is alcohol is, again, in a very non-scientific, bold, simple way, it hides our pains and aches. So if you look at the history, long time back, before we kind of found or discovered anesthetics, they used to get patients drunk before they had to chop off a person's limb. So it is in another way, it kind of makes you numb and resistant to pain. Now, when you stop alcohol, all of a sudden, all the aches and pains that it's already there in the body that had been masked come up. And a lot of time, quite commonly, people attribute that to stopping alcohol. So they think alcohol made them feel good, and now when I stopped alcohol, I'm getting all these aches and pains. It's not really that. What happened was sometimes the aches and pains are attributed to alcohol. Because now alcohol, when you take it for a long time, it affects your nutrition, it reduces, or it deprives you of some nutrients, it damages your liver, it damages your other organs, when it's very, consumption is very high, it damages your nerves, it has a lot of impacts across the body. And when you suddenly stop alcohol, all these aches and pains appear, they have been masked by alcohol on a long-term basis. So you should not attribute that to alcohol. Second thing is, when alcohol, it's something that affects our brain, and when you withdraw that, there are a lot of complicated things that can happen with the brain. Again, it's best discussed with a psychiatrist, but we call it withdrawal. So these kind of complications that can arise. So it's always good, if you've been a heavy drinker, to get help before you completely stop.
So, Doctor, worst case scenario where the liver is concerned.
Right. So liver, when alcohol is consumed on a long-term basis, again, on a regular day-by-day basis, the liver gets damaged. As I mentioned earlier in a previous program, our liver is it's got a very remarkable organ where it can actually supply or do things for 3 people. And when the liver needs to be significantly damaged, roughly about 70% of the liver needs to be destroyed for us to feel anything at all. So until that time, the person who's drinking would think, okay, I'm absolutely fine, I don't have any problem. And by the time they feel or they have any problem, it's way too late. Then it's a fall down a cliff. And it is important to understand this and stop before you get these problems and before it's too late. Now, good thing about alcohol-induced liver injury is now it affects the liver in 2 ways, as I mentioned. The long-term effect is that the liver cells die and they are replaced by what we call scar tissue. That is tissue that is made out of something similar to akin to fiber, and that cannot do its normal liver's job. So that causes the liver to shrink, and that is what we call, when that goes beyond a certain amount, that we call that cirrhosis. Now, on top of that, alcohol causes it batters the liver. So think of a man who's being battered the whole time, and so he has aches and pains. He's very weak while he's being battered, and that is a similar thing happens to the other normal liver cells as well. And when you stop alcohol consumption, these cells recover. So when you completely stop alcohol, over a period of 3 to 6 months, the liver actually recovers. And by that time, sometimes we would have labeled someone as having significant liver damage, liver failure. By the time you stay off alcohol for about 6 months, you would have come back to a stage where it can sustain a normal life. So that is the fantastic thing about alcohol can kind of induce liver injury. Where you stop alcohol, you can recover to a certain degree, and quite often, if not, the liver recovers to a level where you can sustain normal healthy life. So it's important to stop even if you have come to that late stage.
Thank you. That's remarkable. But doctor, on the other hand, if it comes to a point where it's irreversible, I mean, nothing more can, good can come out of it. The deterioration has set in, and that's it. I mean, nothing more. It's more of a decline then.
Yes, so unfortunately, when we give the diagnosis of cirrhosis, that is when liver cells die and they're replaced by these different type of cells. The liver cannot be regenerated at that point. So it is a irreversible diagnosis, but it is a continuum from the normal liver to that very badly damaged liver to the place where the liver cannot sustain life at all, and when they die. So it is in that continuum, reversibility is also similarly reduced. So what again, even if you have come to that stage, the most important thing is stopping alcohol, and that makes the remaining liver work better. And then it is a matter of getting medical attention and managing the condition that we call alcohol-induced cirrhosis. Cirrhosis, once it sets in, is the same in all people, and irrespective of the diagnosis, or rather, irrespective of the cause, etiology, cirrhosis, its outcome, its complications are the same, and we need to monitor them for certain things. We need to monitor them for complications of cirrhosis. I think we discussed that on a previous a program, where they can have bleeding in their gut, they can affect their brain, it can make them swell up, make their eyes go yellow, and there are a lot of other complications, and sometimes they can get cancer in the liver. So these kind of complications can arise, and it is up to the doctor to monitor the person, follow up as the doctor has advised, and if these complications arise, a lot of them can be effectively managed medically or surgically or via other means. So currently, the main modality that we can help these patients is in that particular way. Now, the important thing is alcohol-induced cirrhosis across the world. Now, there are other countries where liver transplant is quite a common thing that is feasible. Still, until you're off alcohol for 6 months, it's not recommended across the world to even think of liver transplant. So
in fact, that was my question, the final question, doctor, because time has caught up with us. Worst case scenario, will a transplant help? So here you say they have to stop drinking at least 6 months before you can even think of going in there.
Exactly. That is scientifically proven, because if they did not have the courage to stop alcohol amidst the diagnosis of cirrhosis, the scientific belief, or rather it's proven across the world in a lot of studies, where once they get a new liver, they would again go back to drinking, and on that new liver, the impact of alcohol is much, much worse. So we are not going to gain anything. That person is not going to gain anything by having a liver transplanted if they continue to drink, because that's not going to even extend their life significantly, because that liver is going to get bad very, very soon. So they have to show that they have been off alcohol for more than 6 months before that is even brought into the table.
Your take-home message?
My take-home message is that, well, first of all, there's no safe limit to drinking, but if at all I am to mention that the liver, what we can do to save the liver if you cannot stop alcohol consumption is one thing we forgot to kind of address: dual etiology liver disease. In that context, mainly to stay fit, eat healthy, exercise more, and then to cut down alcohol consumption as much as possible, and have as long as possible have gaps in between your drinking pattern. But it is best if you can stop alcohol altogether. And also, if you have been taking alcohol for a long time, it's always good, even if you don't have any symptoms, to get yourself checked, and if you have any condition, to make sure that you get enough proper and adequate follow-up.
Thank you, doctor. On that note of advice, we end another interesting discussion, this time on alcohol-related liver disease. Thank you very much to you, Dr. Isurujith Liyanage, consultant gastroenterologist, University of Sri Jayewardenepura, for coming back to our studios and addressing this interesting topic for the benefit of our listeners. Thank you so much, Doctor.
Thank you very much. It's always a pleasure to be here.
And my thanks go to Nadira Manamperi for technical assistance. I'm Fatima Razi Kader, saying good night, and hoping to catch you next Monday, same time, on Views on Health.